Everyone. Today we're going to speak with Becky Spoehr. She's a physician assistant who specializes in emergency care. So, Becky, thank you for taking the time out of your schedule to talk with me for a little bit today.
Oh, it's a pleasure to be here.
Can you share just a little bit about your background?
Yes, so I am a physician assistant and I've been doing this for about 16 years now. Most of the time I've been working in emergency medicine for years and years. And I've also done a little bit with orthopedics. And my current job, I'm now working in an urgent care.
So, Becky, what do you do to maintain your own mental health?
I do have a therapist, of course. She has really been helpful for me, especially during times that I was experiencing high work stress and burnout. Um, in addition to that, I set very firm work-life boundaries. The career I've chosen can be very high stress, and I found that that's just very important for me to not develop that level of burnout that makes it hard to help others. And then just in my personal time, I'm prioritizing exercise, nutrition, and spending time with my family, friends, and my dog.
I love that you were comfortable enough to share with us that you have a therapist. Um, I really appreciate your willingness to be that vulnerable and open. So, if somebody were to experience a mental health crisis, they're often directed to go to an emergency room. And we all know that hospitals have different protocols, but generally speaking, in your experiences, what could somebody expect if they were to go to an emergency room in a mental health crisis?
So I'm actually going to give you kind of two parts to that answer. I'm going to start by describing what the process is like on our end when we have a patient that comes in and they're experiencing some sort of a mental health crisis and they're seeking help in the emergency department. When that happens, the first thing is that you're going to see a nurse and she's going to initiate triage. Triage means that she's going to ask you a few questions, take your vital signs, maybe order some initial testing, such as like an EKG, for example, right off the bat. Just trying to figure out what's going on with you, what level of care do you need, what are the next steps to work on immediately. The next step, so they have determined, are you at a risk of harming yourself or somebody else? And if they are concerned that you might be, the next step will be to initiate safety measures. So place you in a supervised location. There might be a security guard or a nurse's aide that will be watching you, and they will take your belongings. They're going to categorize them, document them, and lock them in a secure area. And you will generally be given disposable scrubs to change into. And all of that is for your own safety to make sure that you couldn't decide to use your personal belongings to cause yourself injury while you're waiting in the emergency department. Um, if you are considered an immediate danger, then they may place you on an involuntary hold. And that's something that's very scary to people. It's not meant to be like a punishment or a judgment. The idea is just to make sure that you are safe, and just to make sure that you are stable in the meantime until we get you what you need. Um, yeah, once they determine that you are in a stable situation, your next step is that you see the medical provider. So that would be somebody like me or an emergency physician or nurse practitioner. And so we are going to take a history, talk to you about exactly what's going on with you at this time, get a little bit about your mental health history. Are you experiencing any injuries, any symptoms? We'll do a physical exam, and sometimes we'll order some labs or imaging. Examples of that is that some things that seem like a mental health problem could be due to a physical problem, such as thyroid or blood sugar. Um, and imaging, for example, if you were intoxicated and you had a fall, they might have to get x-rays of your neck or a CAT scan of your head. This is all to clear you from a physical health perspective and make sure that you're safe to move on to the next step. If you come in and you are intoxicated, they will hold you until you are considered clinically sober. And this can take hours, and we can generally calculate that based on your blood level of alcohol and determine when you will be considered sober. And then we can move on at that point. Once all the labs, exams, and any urgent issues are addressed, you're now considered medically cleared. And that means that you are stable for the next step, which is your mental health assessment. At that point, there's going to be a crisis counselor or a mental health worker who is going to do a deep dive interview. They ask you a lot of questions about your current situation, your history, your medications. Are you safe? Do you have a desire to harm yourself or others? Um, and they may reach out to your family and friends for additional context. Um, After that assessment, their plan is then to determine what you need next. So this might be that you are unstable. For example, maybe you are in acute psychosis. In those cases, you might need an inpatient psychiatric stay, and they will work to get you a bed in the inpatient unit, and they will keep you safe until that can happen. If you are deemed stable to go home, then they will set you up with whatever resources they have available. And so that depends on the department. Sometimes they will have um, like a psychiatrist or a psychiatric nurse practitioner available to determine if you need medications and get the ball rolling on that. Other times that is kind of a something that requires a specialist, and some departments that might not be able to start that. We might be able to get you started with, you'll have an appointment when you leave or get you phone numbers for resources for what you'll do once, once you're done with this. Um, as far as what it actually feels like for you as the patient that is visiting the department, this is a long, frustrating experience. I am not going to lie. So it's the emergency department. It is often overcrowded, highly stimulating. Um, we are often just bogged down. There might be a staffing issue. There might be a lack of beds. Sometimes the hospital is full and we can't move patients that are ready to be admitted out of the ER. And so those patients are stuck there taking up beds and bottlenecking the whole process. And there's just a lot of moving parts, as we just discussed, and any one of those can back things up. So if you feel that you're waiting and waiting and nothing's happening, understand that that is why, but we are also frustrated with the situation, and we want to move things along and get you the help you need. You will have people there making sure that you're safe and making sure your needs are met. And it's probably just going to take a little bit of patience, but know that you will get what you need if you can just hang on a little bit.
So, what can someone expect the end result to be after having an ER visit for a mental health crisis?
So by the time you leave the emergency department, you will have had a medical evaluation, and we have assessed your safety and kept you safe. And you've received a mental health evaluation. And then you will walk away with the next steps, whether that be referrals, whether that be possibly medications, or a follow-up appointment, or if you are actually admitted to an inpatient facility. What is important to understand is that this is not a situation where you're going to leave and be 100% back to normal. These things take time. We are making sure that you are safe and stable, and then initiating the next ongoing process. And it's going to take some engagement from the patient to be able to do their follow-ups and take any recommended medication and just do the work personally to make sure that they continue to recover.
What advice would you offer to someone who was thinking about going to the emergency room or to take their loved one to an emergency room for a mental health crisis?
So a few things. I would say know that unfortunately nobody does want to go to the emergency department. It is stressful, it's unpredictable. But if you are experiencing a crisis, this is the right place for you. This is where you need to go to get help and make sure that you are okay. Some examples of when it is appropriate to go is if you're having active suicidal thoughts, if you have a specific intent or plan for suicide, you're having hallucinations, you're in a severe manic episode, all of these things will need an emergency level of care. Um, my biggest advice if you have decided that you're going to be going through this process is if you can just get your situation in order before you come in. If you can have your med list, phone numbers of any psychiatric providers, and if you can assign somebody to help you with any day-to-day tasks, maybe caring for your children or pets, house sitting, notifying your job if you end up missing work. Unfortunately, this process can sometimes take a lot longer than you might expect. And just knowing that you have somebody to care for these things for you while you're gone, and then you can really focus all of your energy on your recovery, which is where it needs to be.
This is some really great advice, some really great information. Thank you so much, Becky, for again taking the time out of your busy schedule to talk with me today. Really appreciate it.
Anytime. And, I hope that this information helps some people out there, and just know that we are here for you. We are trying to help you. You might just have to be a little patient.
Thank you, Becky.